Alright, hi, so we're going to be doing a nasogastric placement. So first I'm going to check the MAR and check the orders from the PCP to insert it. So I have gathered my material, so I'm going to enter the room. Knock, knock. Hi there, my name is Kaylee. I'll be your nurse today, and I'm going to perform hand hygiene and provide for privacy. Can you tell me your name and date of birth?
Mr. Jones, 5/12/96.
Alright, that's what your armband says. So Mr. Jones, today we're going to be placing your nasogastric tube. And what that is a tube that goes into your nose and down to your stomach. It's usually used for medication administration and help with nutritional needs. Do you have any allergies I should know about?
Nope.
Alright. And are you experiencing any pain at this moment?
Nope.
Okay. So now I'm going to be just checking the nasal passage just to see which nasal passage would be best. Have you had any surgeries in your nose or any nosebleeds that I should know about?
Nope.
Alright, so I think I'm going to go into this left one. And I was just looking for obstructions that could differ. So Mr. Jones, do you have any questions before we get started?
Nope.
Okay. So I'm just going to raise the bed to an appropriate working height and put it in high Fowlers. And that's just going to help with the administration of the tubing. So once it's in that position, I'm going to open up all my material. So I have a syringe that's going to help with checking the pH levels and the tubing. So I'm just going to put this bath towel on your chest, Mr. Jones, just if there's any leakage, we don't get it all over your bed. Here's a emesis basin, just in case you have the urge to vomit. And then here's a towel, just in case you need to wipe away any tears or any drooling that you may experience. Alright, so now I'm going to be measuring the length of the tubing. So I'm going to start at the nose and work to the earlobe and then down to the xiphoid process. Okay. Down to the xiphoid process. And I'm going to make a mark on that just so I know that that's kind of where I need to be so I'm in the stomach. You can also use a piece of tape if that helps. So I'm going to just press this on at the clean kind of counter and put on my gloves. So Mr. Jones, I'm going to be inserting this, and once it kind of reaches your pharynx, you'll start to experiencing some gagging, and that will be an indication that I would like you to do, put your chin towards your chest and start taking sips of water. And as you are sipping the water, I will be inserting the tube farther down, and that just helps with making it less painful. If at any time you're experiencing discomfort, please raise your hand and I will stop. And also if I notice any signs of disturbances such as shortness of breath, gagging, coughing excessively, and kind of gasping for air, I will stop the procedure as well. So there's your cup of water with a straw. Just have you hold that. So I'm going to take this lubricant so I can get the tip of the tubing lubricated. Alright, Mr. Jones, can I have you take a deep breath for me? So we're just going to be working on the floor of the nasal passage. So how are you doing so far?
Good.
Okay. So I have reached that pharynx. So Mr. Jones, can I have you put your chin to your chest and start taking sips of water? Alright. And with every sip, I will insert it a little farther. I'm not going to put any force on it. Okay. So I'm just going to go down to the marking was that I had made. So at that point, I'm going to just kind of secure it gently with a piece of tape while I check placement of the tubing. Alright, so there's a little placement just so it doesn't kind of fall off. So then a couple ways that you can check to see is, number one priority is doing a chest x-ray to see if that placement is in the right spot. But you can also do a bolus of air of like about 30 mils, and you can have a second nurse listen for the abdominals, see if there's any gurgling, which kind of indicates that it's in the stomach. You can also aspirate back some stomach contents, which you are going to want to do to check the pH level of the stomach itself. So I took out about 30 mLs that I will be using later on a test strip. Once I know that it has been in the stomach, I'm going to put this above where the stomach lies, and I'm going to secure that nasal piece with a piece of tape. You still doing okay, Mr. Jones?
Yep.
Okay. So I'm just going to take off this little piece that I have here. You're you're just gonna wrap it around that nose piece, like so. And then you're ultimately gonna wanna take a piece of tape and tape it onto their gown. You can also use a safety pin and a rubber band, or any other kind of anchoring device that you have available for you. You can also kind of clamp off this insertion site with the airway valve. You want to make sure that it's above the stomach. All right. So now I'm going to check the pH with a pH strip and just kind of make sure that the contents is at the appropriate, about 2 for pH of the stomach. All right. Mr. Jones, do you have any questions? Are you feeling any pain or discomfort right now?
Nope.
All right. I'm just going to clean up all my mess here. I'm going to lower the bed to an appropriate height. Alright, so Mr. Jones, your call lights are at the sides of your bed. If you are experiencing any shortness of breath, discomfort, are vomiting a lot, please let us know. And I will be back in 30 minutes to check on how the tubing is doing. So now I'm going to wash my hands, and then I would be documenting the procedure, the time and date, who administered it, what nasal passage I used, which I used the left, and then I would document the color, consistency of the stomach content that I aspirated back, and then I would also document the pH level. Thank you.